This morning, we sent out a press release that had a link to the Monitors Team website, which has a link to the Crisis Intervention Team policies and the General Police Order that is now open for public comment. This morning, we have with us several individuals that will help talk about and answer questions that you might have about the CIT policies and the General Police Order. With us is U.S. Attorney Carol Rendon, Implementation Coordinator Greg White, Adams Board CEO Mr. Bill Denahan, Employee Assistant OIC Melissa Dawson from the Division of Police, CIT Coordinator Captain James Purcell, and monitor team member could not be here this morning, but they're also available if you wish to contact them about any particular questions that you have. And so at this time, we're going to open it up just for questions. If you have questions in specific about CIT policy, we want to stick within those parameters and go ahead and take your questions. I was that good.
Well,
Just a little overview maybe. Yeah.
we would, the Cleveland Division of Police, along with the U.S. Attorney's Office, would like to thank the Mental Health Response Advisory Committee, and particularly the subcommittee. There was a policy subcommittee co-chaired by Judge Holly Gallagher and Gabriel Celeste of the Schubert Center at Case. They helped us, along with quite a few members from the community, actually write these policies. We think they're best practice across the U.S., and we already have some input from the community, but we're actually looking for more input. So if everyone would please review them on the website, and then we can make any adjustments as needed so we can get these policies out and have our officers trained on them. Thank you.
I also want to mention that there will be two public meetings on the 13th of December. One will be at the Murtis Taylor Human Services Center at 13422 Kinsman Road, and then that will be at 1 p.m. on the 13th of December. And the second one will be on 13 December at 6 p.m. and that's at the Urban Community School, and the address there is 4909 Lorraine Avenue. Again, the public comment period will run through that date, and then we'll collect all of the information from those who have comments about the policies and the General Police Order, and culminating with two public meetings where people can come, bring their comments, and we'll take all those comments between now and those dates. Okay.
Good morning.
Good morning.
I'm Bill Denahan. I'm the CEO of the Adams Board, and
That's okay. It's nice.
and chair of the Mental Health Advisory Committee that looks at the and makes recommendations relative to the Crisis Intervention Team. This policy sets the stage for officers to be trained and provide the excellent service that is expected of them to all citizens of Cleveland, not only those that are mentally ill, but all citizens. And I want to also commend the collaboration of everybody that's involved. We have about 80 volunteers from providers to professionals to judges to folks in this room and the police department working together to formulate and determine these policies. And we're very excited about it, and we're looking forward to the public input and bring it to recommendations for the monitor and ultimately the judge to officiate. So just want to make that comment, and thank you. Answer any questions.
I'm just going to make one brief statement about what this policy is really all about. There are basically four things we're trying to accomplish here. One is to assist people in our community who are in crisis. The second is to improve safety for police officers, people in crisis, as well as their family members and other members of the community, to promote community solutions here. And I think that's what Mr. Denahan was saying, that it's a community solution. All the different groups are involved in this. And finally, to avoid the necessity for intervention by the criminal justice system unless there's a serious matter involved. So those are the four things we're trying to accomplish by these policies. And I'm confident that proper training, that we're going to be able to do that. So thank you. Kevin?
I just would like to thank the Cleveland Division of Police for the incredible amount of work that they've put into this. In particular, Captain Purcell and Deputy Chief O'Neill have spent literally hundreds of hours working with the community, with our office, and with the Department of Justice to put together what we believe truly are national best practices for how to handle people in a behavioral crisis situation. So one of the things that people don't often realize is that the police are called often for things that are not crimes. Oftentimes, a family member is dealing with somebody in a behavioral health crisis situation, and it's just gotten out of hand, and they don't know what to do, and they don't know who to call. And so they do what we all would expect them to do. They call 911. And then our incredible police force arrives, but they're not social workers, and they're not psychologists, and they're not necessarily trained in how to handle non-criminal situations involving people in very difficult circumstances, who often simply are unable to comply with the commands of the Cleveland Division of Police. And so what these policies do is help set out a framework for how the division is going to handle those situations going forward. And they truly are a model for the nation. One of the things that we're really lucky to have here in Cleveland is this incredible monitoring team. And amongst the members of the monitoring team is Dr. Randy DuPont, who actually created what we've all called the Memphis model, which was the first police department to really look at how to handle people in a crisis situation. And with his expertise and the incredible work of Bill Denahan and the Adams Board, Heather Vollison from my office, who's taken the lead on these particular policies for the Department of Justice, and everyone from the Division of Police, we really have put together a series of policies, and a training protocol will follow to allow the police to more effectively deal with these situations. And as Judge White said, one of the principal objectives of this is to make sure that our officers are safe and that our citizens are safe in these encounters. And so we're really looking forward to hearing what the community has to say about these policies, getting them in final so that we can file them with the court. And I'm really pleased that this is yet another next step in the implementation of the settlement agreement in this case and the reform of the Cleveland Division of Police. It's a major next step and one we're really pleased to be participating in today. So thank you.
A couple of people came in late. Does anyone have any questions? Could you give us those dates again for the public comment?
The public comment period is the 13th of December. The first one is at 1 p.m. on the 13th at the Murtis Taylor Human Services System, and that's on Kinsman Road, 13422 Kinsman Road. The second one is December 13th at 6 p.m. And this is in the release that we sent out as well, but it's at the 13th at 6 p.m. at the Urban Community School, and that's at 4909 Lorraine Avenue. One is on the east side of Cleveland, the other one's on the west side of Cleveland. Any other questions? Eric?
I was reading through this thing. You kind of look at it through, I guess, Cleveland's history, and maybe even history nationwide of police use of force and mental health response incidents. And if you look through it, you can kind of see, at least from my perspective, that these are based on, I guess, real-life situations where something may have gone wrong. You talk about cuffing, for example. If they're on the ground, they have to be sit up. Can somebody talk a little bit about, I guess, how real-life situations, and maybe even those in Cleveland, ended up informing the ultimate proposed policy that we see today?
Okay, and that would be for?
It doesn't matter. It really doesn't.
Captain Purcell.
Anybody who can respond to that.
I can respond to that briefly. The thing we do with this policy is our general police orders, our general guidelines for guiding behavior of our officers when handling these calls. The thing we do with this policy is go much more in depth in what we've done in the past. And we've gone into specific situations. We've gone into responsibilities of our dispatchers, our officers, our CIT team officers, and our their supervision. So the truth is we're we're attempting to provide a much more specific guideline for all the officers to guide their behavior, because we see that as a way of better outcomes for our special needs population.
So, yes, real-life situations that may have gone maybe a little worse than they'd originally expected did end up informing this. I just want to make sure I heard that correct.
I don't know that we looked at any specific situations. We're looking at the general demeanor of officers toward people that might be in crisis. We're looking at specific ways of handling them, specific ways all the way through the process. How the approach they take, the conversation that takes place. If it has to come to, they need an intervention where they might need a higher level of psychiatric care, we want to guide them in how to do that. We weren't trying to look at a specific situation. We're looking at a guideline for all situations.
Yeah, and if I could add that to that, Captain Purcell, what the policy subcommittee did is collect some 22 policies from across the country and really try to find and get all the best practices from all of these different policies across the country. And we had, the crisis intervention expert, Dr. DuPont, help formulate those policies for the division. So they did an incredible amount of work based on, collecting all of these. It was a months-long process. Yes. So that's how we were able to come to what we believe is a model for the nation and for other departments across the country.
Another question, this is an easy one. How many CIT officers do you guys currently have trained?
We currently have 600 officers that have been through the 40-hour CIT training.
Do you anticipate kicking that up? I didn't know if you guys,
Well,
it's a good base number, how that works.
we're looking into a new, redoing our training, looking at our whole 40 hours, and with an initial 200 officers approximately to be our core team of the people that respond to the vast majority of these calls. And every officer in the department will receive 8 hours of CIT training annually. So we're going to train everyone with 8 hours on an in-service on an annual basis. But we're going to start with our original, we're going to look at doing 200, and then once we have that initial core team, then we'll look to expand from there.
And how many in a given shift? And the only reason I ask that is if you read the policy, it says if they're at a low priority call, for example, they can drop that and go. So I didn't know the availability of these officers on a given shift.
We're looking at somewhere from a third to 40% of our officers. That number comes down to, if you look at shift by shift throughout the city, and those numbers are broken down by shift, there'll be at least a third of the officers trained, CIT trained to respond to these calls. And most of the shifts have a little bit higher number, closer to 40%.
Captain, can you respond at all about maybe some feedback from your officers or the general public as to how this training has helped in situations so far? Have the officers that have been trained come back to you and said, man, I wish I knew this earlier, or that really helped me get through this one today?
We've gotten a lot of positive feedback from the officers. As a matter of fact, officers that were trained a number of years ago, we've had officers that were trained up to 12 years ago on this, our original training. And they were still enthusiastic about it. And they're still saying, is there anything new? Should I take the training again? Is there something else I should know? Is there some other training I can go beyond this? And we are looking at some of those types of training too, some specialized training for different populations that we deal with. From the community, we've heard positive things. A lot of our officers that have gone through the CIT training, a lot of them wear a pin on their collar. It's a CIT pin. We've had people respond positively to that. They realize they're CIT officers and that they're trained to deal with special needs population. And we've gotten some excellent feedback from the community also. So on both sides, both the police and the community, we've heard some good feedback about our CIT program. So.
Is it a case for some of the CIT officers are working with officers that have not been trained yet and are learning from each other? Is that the kid you're trying to work that into? Is that?
Certainly, I mean, especially as everyone that comes through the police academy now has 20 hours of CIT in the academy. And it's now an OPATA standard, the 20 hours. So they're getting a portion of that, and they are, our FTOs, which are field training officers, are supposed to be CIT certified, that they have to be trained with the 40 hours. So everyone that's going to work with them, they are going to get a portion of that from the officers that are training them. And then obviously we're always looking to get officers that are enthusiastic about this into the program and be part of the team.
Captain, you said that there were some guys, some officers who took this training 12 years ago and were asking if there's anything new. Is there anything new from 12 years ago?
There's always new things. I'll say that. The core of the program remains the same, and a lot of it's about approach. It's about the general police thing is command and control of the approach when we start to think about suspects and law enforcement. And that is not the mindset we necessarily want with dealing with special needs population. We're looking at kind of an active listening, being a little more open to what people have to say, and have a little more understanding and maybe a little more rapport with them, so we can deal with them and get some better outcomes for them. So
Can we see what the pin looks like?
I don't have one on me. I can show you after, certainly.
How will dispatch know this is the right officer to send?
Okay.
On the call center?
At the beginning of every shift, all the officers that are going to be working that day, there's a beat, what we call a beat sheet sent to radio. That's all the officers working, and each CIT officer is identified on that sheet. And our dispatchers are also receiving 20 hours of training in CIT for both our call takers and our dispatchers. They're going to be handling these people on the phone and then dispatching appropriate officers to the calls.
Any other questions?
Anyone else?
Well, if not, thank you again for the quick response and coming up here for the media availability. And again, just to recap, this is a holistic approach to crisis intervention team effort, not just the officers, but the dispatchers and the call takers, so that everyone is on the same sheet of music. Again, thank you for your time, and thank you all for being here.